Hello, it's Dr. David Mintz. I wanted to go through some of the anatomy that we see on CT chest, particularly for cases that involve rule-out pulmonary embolism, just to get people familiar with the anatomy so they can look through cases themselves and have a pretty good idea of what they're looking at. Well, here we have a case which is negative, but it is designed to demonstrate the anatomy clearly, I hope. And I'm going to run through it here quickly. First, just to kind of give you an overview of what we're going to be looking at. Okay. Now, in terms of getting your bearings on these scans, I think the best place to start is at the aortic arch, and that's something that we can all find pretty readily. So here's the aortic arch right here. Okay, you have the trachea and the esophagus, and here you have the superior vena cava. Now if we go up a little bit higher, we'll see which arm was injected for this study, and we can see that the right arm was injected. Here you see opacified contrast coming in from the right side into the right brachiocephalic vein. And then the right brachiocephalic vein here is going to come into the SVC with the left brachiocephalic vein. The left brachiocephalic vein, of course, is not opacified. And so, when we get down a little bit lower, you see the two of them kind of mixing. So here you have opacified blood and some unopacified blood. Just to get your orientation here. So here you see the SVC, here's the aortic arch. The key concept about the pulmonary artery is that it branches under the arch. So if you think about that, then you go lower and you say, okay, here's the pulmonary artery, and it's branching under the arch. Well, which is the main pulmonary artery and which are the left and right? Well, the pulmonary artery dives posteriorly as it exits the heart. So this is the main pulmonary artery coming back like this, and of course you can see that we're at about the level, just below the level of the carina. So here's right main stem bronchus, left main stem bronchus, so you can use those as your guidelines. And I'm going to go up a little, or down a little bit here, below the carina, and we'll go up to about the level of the carina. Okay, so here you can see left main stem bronchus, right main stem bronchus. We're right below the level of the carina, and here's the esophagus. Ascending aorta, descending aorta, and therefore we are below the aortic arch, and so here we have the main pulmonary artery branching into the right and the left main pulmonary artery. This, of course, is the SVC, and you can still see, even on this suboptimal image, a little of the mixing effect, some low density here, which is the mixing from the unopacified blood coming from the left arm. Okay, so main pulmonary artery, right main pulmonary artery, left main pulmonary artery. Let's go down and look at the main pulmonary artery here, and we should see it coming into the heart, or arising out of the heart, okay? Here we go. So now here we are at the level of the heart, and here we can see a pretty good profile of the heart, right and left side, and of course the left ventricle can always be pretty readily identified because of the thicker myocardium, plus the fact that it's more posterior and somewhat leftward. So this is the best way to identify the left ventricle right at a glance, that thicker myocardial wall. So you have left ventricle and right ventricle, and therefore you know right atrium and left atrium. So that gives your orientation. So if this is the right ventricle, well, the pulmonary artery should arise up from it. So if we go superiorly, you should start coming into the pulmonary outflow tract. And let's see if we can point it out well here. Here's the right ventricle. Remember, right ventricle, right atrium, right ventricle. And now I'm going to move superiorly. And so here it is here. And this is going to dive back. Now this is the ascending aorta. And this is the pulmonary outflow tract. A lot of times you can actually see the valves in there too. But here we are. So here is the main pulmonary artery then. Here's ascending and descending aorta. And now as we go up higher, you see that the main pulmonary artery is diving back and up a little bit, posteriorly and a little superiorly, to branch right under the aortic arch. So here you see the right main pulmonary artery coming off a little lower. Then we go up a little higher. Here's the left main pulmonary artery coming up a little higher than the right. Once again, right and left main stem bronchus, esophagus, ascending aorta, descending aorta, and superior vena cava. So we're looking for filling defects in either at the bifurcation here, a saddle type embolus, or in the right or left main stem bronchus, right or left main pulmonary artery. And these emboli, when they do occur, tend to aggregate right at branch points. So if there's not a saddle embolus, you'll see it either accumulating here or here, right at the branch points of the distal main pulmonary arteries. And of course, in some cases, there will be very small pulmonary emboli in small branch vessels, and you will still see those generally at branch points. Now, I don't see any here, but in other words, here you see this artery starting to branch, so one could become lodged, and then you follow an artery like this, a pulmonary artery, and you see it branch, and this would be about the location that a clot would get lodged. Okay. And we'll see a little bit more in a moment. Now I just want to go to a coronal. And here, this is the same patient, just to give you your orientation, because these are often very helpful, and they can actually be quicker, because going through a coronal like this, zip, is often the quickest way to get a quick view and see if there's obvious PE. So if you want to get a look yourself, you just kind of go through like this. All right, now let's start from the back and go forward. Here we have the descending aorta, of course. So we move forward and follow the aorta, and here you see we are coming into the aortic arch. So you know that the main vessel beneath that, inferior to that, is going to be the pulmonary artery. And so here we have two pulmonary arteries, a right and left pulmonary artery. And then if we continue forward, remembering that the main pulmonary artery arises from the right ventricle and dives up and back, superiorly and posteriorly, here we have a coronal image showing beautifully. Well, let's just look at this. Where's the left ventricle? Here it is. Here's the thick myocardium of the left ventricle. Here's the left ventricular chamber, and that is exiting as the ascending aorta. And here you can even see a branch vessel coming off the aortic arch. So that means more anteriorly we should see the right ventricle, and here's the right ventricle. Remember, it's more anterior than the left ventricle. So here you see the right ventricle is coming out as the pulmonary outflow tract, and we follow it back, and it becomes a little more clear as a tubular structure. And then, as it dives under, here we're coming into the arch, because you see the great vessels coming off the arch. So here is the beginning. We're going from front to back. So here is the first few cuts through the aortic arch. Here is the main pulmonary artery diving back, and it's going to branch under the aortic arch. And sure enough, we get back a little farther, and here you see it giving off the right main pulmonary artery. And at that same, just beyond that point, we see it more clearly, the left main pulmonary artery. The left main pulmonary artery dives back a little bit more straight than the right pulmonary artery. So this is a good place to look if you follow that, and just get your orientation by looking for that branch point. Here we are, main pulmonary artery diving back. Here we are under the aortic arch, and we see it branching to the right and left. So you want to look in these areas for significant filling defects and more posteriorly here, and in some of these little branches here. So for a quick overview, that kind of gives you an idea of what we're looking for. So the key is to get your comfort level with the anatomy and know what you're looking at and key off things like the aorta, especially the aortic arch, and confirm your orientation and your vessel identification with things like the superior vena cava. Okay. Okay, I wanted to pick up, this is Dr. David Mintz, pick up where we left off. We'd gone over some normal anatomy, and here we have a positive study. So I'm going to do the same thing here, going to start off, this one goes from bottom to top, and kind of give you an overview of what we have here, kind of run through it. Okay. And I'm going to start from the top now. And here you can see the opacified right subclavian vein and right brachiocephalic vein and the great vessels. Of course, the three vessels as they come off from the aortic arch are going to be the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. So as we go down from here, you'll see those three merge into the aortic arch. And this patient has good opacification of both the left and right brachiocephalic veins. So as we come into the superior vena cava here, we won't see the mixing that we did before of opacified and unopacified blood. Back to the aortic arch here. This is the aortic arch. And as we go down from that, we're going to see the main pulmonary artery branching under the arch. Here's the main pulmonary artery. It's branching under the arch. The left is a little bit higher, so we see that first, and then we go down a little farther, and we see the right. So now you see that Y configuration, which is kind of oblique. Here we go. Main pulmonary artery, right and left. So the big place to look for the common PE are going to be at the branch points of the distal main pulmonary arteries. And sure enough, look here. Here you see clot. You see filling defect in the distal right main pulmonary artery, right where it's beginning to branch. And you can see it extending down into the pulmonary arterial branches and probably up into the right upper lobe too. But we see it more clearly going down to the right, and you can see it just socked in here, this right lower lobe artery. Okay, and you'll also notice, if you're wondering what you're seeing is real, almost every case you see is going to have a tubular or cylindrical kind of appearance. All of these clots, of course, are casts that are formed in the deep venous system of the legs, and therefore they are tubular or cylindrical structures, and you can appreciate that detail, that characteristic on almost every study. Now let's go to the left main pulmonary artery, back to our origin here. We're under the arch, ascending and descending aorta, main pulmonary artery going to the right where we've already been. Now we're going to look at the left and look at its branch points. And as we go down, doesn't jump out and get you quite as much, but you can see right here, even though it's suboptimal, there's a little filling defect, has that tubular kind of character. And that is a pulmonary embolism. Let's go down a little bit lower. Okay, if you follow it up, you'll see it extending here into a left upper lobe pulmonary artery branch. So it's hard to make any of these diagnoses on one image. So most of the time you have to kind of go back and forth and go, aha, yeah, this little thing here, which could be just a nothing, like it is over here, here it's just a cut through the edge of the vessel, is this real. Look at it and see if it pans out, following it up into the main pulmonary artery branches to that left upper lobe, and sure enough, you can see there's that little defect here, and then following it back down, you go back and forth, and here you see again that cylindrical or tubular character that most of these seem to have. And then as we go down farther, now in fact you can see in a left lower lobe pulmonary artery branch, there's a filling defect. Is it real? Sure, we look above it, look below it, go through it, and say, yes, in fact, it looks like it is, as we expect, kind of hung up right here at a pulmonary artery branch point. And that's about all there is to it. The only other issue is looking out if we don't see them in those locations, looking out for them in these smaller vessels, which can be subtle and just take some time to look at a number of cases and get comfortable for what is and is not positive. The one caution I would suggest, though, is when you see a vessel here that you think has a clot, make sure it's not pulmonary vein, because pulmonary veins have extremely variable opacification on these studies, and the way you find out if it is you follow it back and see if it's going back into the the left atrium, as oxygenated blood will, into the left atrium. So these are all pulmonary venous branches. Now, once again, following those down, you'll see how they intermingle with the pulmonary artery branches and can be difficult to distinguish, but you can follow them back up, and also if you change the windowing, you will see that the pulmonary artery branches follow the bronchi, whereas the veins do not. But usually that's not a big problem. Usually if you see a filling defect, you can follow it back up and say, oh yes, it is in fact connecting with that main pulmonary artery and its main branches. Okay, Dr. Dave Mintz here, and I wanted to continue on another case. This is a 71-year-old female with shortness of breath. And I'm going to go from the bottom to the top, just kind of give you an overview, which is what I usually do. Just kind of spin it, take a quick look, see what's going on. Okay, now here we are in the superior mediastinum. We see the opacified left brachiocephalic vein coming to join the right brachiocephalic vein, and you see them merge to form the superior vena cava. Going back up, here we see the three great vessels, brachiocephalic artery, left common carotid, and left subclavian. Here's the trachea and the esophagus. We'll go down a little bit, and then we will see that we are in the arch. Here is the arch of the aorta. So if we go below that, we should then come into the branching of the pulmonary artery. And indeed, here you have the main pulmonary artery coming in and branching to the right and the left. Now you can clearly see that there's a filling defect right in the right main pulmonary artery, and that's because it is getting lodged at the branch point, where of course the pulmonary arteries reduce their caliber, and that's why they get lodged at this location. And again, you see very nicely the cylindrical or tubular character of this filling defect. And you see a large clot now extending down into right lower lobe pulmonary artery branches, and so it's very positive. Now let's look down here and we say, okay, well, it looks like there's something right here. That looks like a filling defect. We can see a thin rim of contrast surrounding this soft tissue attenuation, so we think that's probably going to be positive. Follow it up. Just keep your eyes right on that vessel here and see if you can establish its continuity with the pulmonary artery. Yes. Okay, so here you have the left main pulmonary artery, and even though we don't have a big clot in it, if we follow the left main pulmonary artery into the left lower lobe pulmonary artery here, we see that when we get to a branch point, a little bit lower here, see right at that branch point, right where this thing's coming off, we see that filling defect. And here it is here. So that alone would be enough to call this a positive PE study. Looking down from below again, which is the left ventricle? It's the one with this thicker myocardium. So this makes this the left ventricle, that's the right ventricle. If we follow this upward, as we move upward, we will see that this area here will continue as the pulmonary outflow tract here, which in turn becomes the main pulmonary artery around here, that in turn branches just below the aortic arch. Ascending aorta, descending aorta. Go up a little higher, we're at the arch. Arch and down, look for the branch, main pulmonary artery, right main pulmonary artery with clot, left main pulmonary artery, okay, that's it. Okay, I wanted to continue with one last case, which is, I think, of value because it's a little more difficult. It's not a big chunk of embolus in a main pulmonary artery. So follow this down. Here you can see we're in the arch. Now we're at the branch, or the main pulmonary artery, and it's branching, bifurcating under the aortic arch. Okay. So that's your overview here. Now let's go back to let's start here from the heart. Here's the thicker left ventricular myocardium. So left ventricle, right ventricle. And nice view of the ventricles there. Thicker, deeper trabeculation in the left ventricle. Very often we can see the papillary muscles there, and this is a papillary muscle right here. And these are the valve leaflets of the mitral valve, which you can make out a little bit in that area in this case. Once in a while you can actually see nicely the chorda tendineae emanating, you get a hint of them here, emanating from the papillary muscle and radiating up to attach to the margins of the mitral valve leaflets. So let's look here in the right ventricle then, and we know that at this point the main pulmonary outflow tract should be, what we're going to encounter next. And although we don't see the valve itself, we're here beyond the valve in the main pulmonary artery. And the main pulmonary artery branches, bifurcates, divides under the aortic arch, and you're not going to get a prettier view of it than that. Ascending aorta, descending aorta, main pulmonary artery branching into right and left main pulmonary arteries. Let's go up a little bit higher. Here we are in the arch. Aortic arch, and here's the superior vena cava. Am I sure that's the superior vena cava? Let's go up and see which arm was injected. Okay, the left arm was injected, left subclavian opacification, left brachiocephalic vein. Here's the right brachiocephalic vein. So when the two brachiocephalic veins join, you get a little bit of a sense of the intermixing of opacified and unopacified blood there. And even at this level here, you see little swirls that are the unopacified blood, but you know you're in the superior vena cava here, and the arch of the aorta. Continuing downward, we know we're in the main pulmonary artery, right and left main pulmonary artery. Now we're not going to see anything in this case in the main pulmonary arteries. So take a look as I course up and down. This is just what I would do, reviewing the case, and look and see if you see any filling defects. Keep looking. Okay. I think that caught your eye too, right? Over on the right. Here we go. I'm going to go up out of them. And now I'm going to go back down. If you look at this vessel here, okay, following that, it branched, no PE there. Here, let's see, still none. Oh, maybe something there. There we go. Okay, here, there's one right in this branch point. Right there, you can see it lodged right at the branch point and extending into the two little branches, just hanging over that little division. And there's one here too. You see that? And if we go up, and then I'll go back down, there you see that. Right, probably lodged right at that level. Actually, it looks like it got hung up right where this little vessel is coming off. You can see it extending just a tiny bit into that. And so that's another clot. And, oh, look over here, we've got another one there too. And this is the little bit harder level where you have the smaller branches involved, but look how nicely you can see the tubular character. Of course, that would be more clear on a coronal image, where you'd catch the length of that pulmonary arterial filling defect. Okay, I'm going to go back down to this to illustrate another point. Here you see a pulmonary artery with a clot. This is a pulmonary vein. Watch this vessel as we go back up. Watch where it goes. Okay, here it is here still. Watch it closely. It's joining another vessel. It's joining another vessel. Where is it going to go? It's going into here. And what is that? It's going up into the left atrium. The left atrium. And here you can see the mitral valve. And so this is a pulmonary vein. So that was a demonstration of the distinguishing feature of a pulmonary vein and pulmonary artery. They're close to one another. If you change the windows, you'd be able to see a bronchus, a bronchiole, right next to this pulmonary artery that's of comparable size to the pulmonary artery, unlike the pulmonary vein, which will not have an accompanying bronchiole. Now here we actually see a little focal consolidation in the left lower lobe, and I think it's a reasonable guess that this could be a small pulmonary infarct, which we often see in a distribution of a pulmonary embolism. Okay.